They were expecting with a higher dose they'll have an even better effect, but they did not. It was very similar to placebo. Later on, it was determined that capsule was not dissolving appropriately because it was too packed with too many strains. So more does not always mean better.
Do you find probiotics confusing? We can all get a little bit lost in this huge world of probiotics. Go into any grocery store or drugstore and we have all of these different options. We know that probiotics can be good for us, but the world of probiotics has grown so quickly. So how does one choose, and how do you know which one is right for you? Do they really make a difference in overall health outcomes? And so I've asked the author of the Clinical Guide to Probiotics in Canada to come on the channel today and answer some of these questions for us. I've also asked you for some of your questions, and so many of you responded, and we're going to answer your questions on probiotics and learn together about the myths and benefits of probiotics. Dragana Skokovic-Sunjic is a clinical pharmacist with Hamilton Family Health Team. In addition to her collaborative clinical practice, she is a leader in knowledge mobilization for probiotics in Canada and the United States. Translating scientific research in this field, she has authored the Clinical Guide to Probiotic Supplements available in Canada and the Clinical Guide to Probiotic Products available in the US since 2008. This practical clinical tool is reviewed and updated annually to reflect the latest evidence and include new probiotic products on the Canadian and US markets. Her project has been presented, published, and recognized internationally, receiving numerous awards and recognition. Dragana's efforts to promote evidence-based education in this field resulted in the establishment of the Alliance for Education on Probiotics, or AE-ProBio, in 2015. AE-ProBio supports publishing the clinical guides to probiotic products and other educational pieces designed for healthcare professionals and consumers.
I've been working as a community pharmacist for many years. And prior to that, I was teaching at the university. So when faced in a pharmacy with the questions about probiotics, I would say some 15, 20 years ago, I would tell my patients to eat some yogurt. You know, there's antibiotic for you, eat some yogurt with it because those good bacteria are good for you. I did not learn in school anything about probiotics. There was not enough studies at the time, or you know, we knew about some evidence, but really did not know about specificity or anything else in more detail. At the same time, in early 2000s, there's more and more research that was looking into identifying specific bacteria as probiotics. The first definition of probiotic was published. It was later updated. So I got curious, and I was also asked to present a series of continuing medical education events, presentations for pharmacists and physicians across Canada on the topic of probiotics. At that time, we did not really have too many probiotics in Canada with a good evidence to support the use. So it was a fun thing to do. And we talk about potential uses in irritable bowel syndrome, in inflammatory bowel disease, in colics in babies. And I thought after we did this series of talks, it was it. However, the feedback from those sessions was excellent, with a common question: what do we do now? Because in those presentations, I could not mention any brand names. Right. I could say Lactobacillus, reuteri, DSM, and series of numbers. Nobody could remember those. And if you tell this to the patient, they have no idea what to look for. So I was asked to prepare a table or a chart as a quick reference for pharmacists, mainly to use in their stores when they have to select a probiotic strain and recommend a probiotic product to their patients. Being a pharmacist, I needed to see the evidence, so I posted all the references, all the studies published at the time. And that initial guide, Clinical Guide to Probiotic Products in Canada, was published in 2008, and it was actually one page. And the first page was the 9 products with the adult and pediatric table on one page, and the back of the page was references. So after that, the things were changing so rapidly, new products coming on board, new studies being published, more and more research, I would say exploding. Market offerings are also exploding, but not always in good products or products supported by evidence. Some known products are changing strains or content. So that means what was working before would not work next time if the strain is changed. So that they identified the need to have annual updates of this guide. At that point, we formed the expert review committee, colleagues of mine, gastroenterologists, researchers that actually volunteered to help me review the guide. So guide grew every year with the new products and the new indications. Right now, I believe we have 24 pages and 300 references.
Wow.
And in 2015, we also expanded to US because we sometimes have the same strains, but different brand names, because the advantage of the guide is that it does list the brand name. So it is easy to recommend to your patient what probiotic brand to go and look for and purchase for specific reason. So that's a bit of a background why I'm so involved in the guide, in probiotics, and in educating about the evidence behind probiotics.
Wow. Yeah, that's quite the story. And, you said that the first kind of summary that you did was at 1 page. And now, like, we have the booklet that you've done, and it's how many pages? Like, you can see the detail, how you guys have really developed this idea along the time that this has been happening in Canada with so many products, and the need for evidence-based information, right? Are these probiotics very well regulated in Canada?
So that's a good question. You mentioned about probiotic. First of all, I like to start with the probiotic definition.
Sure.
Any live bacteria is maybe live bacteria, maybe good, maybe bad, but it doesn't mean it is probiotic.
Okay.
For a product or food to satisfy definition of probiotic, it has to have live bacteria that is present in adequate amounts that will actually confer a health benefit on a host. That means it will make a difference for us that is measurable. So eating yogurt is great. It gives you lots of protein, calcium, some live bacteria, but not most probiotics will have, yogurts will have probiotics in it.
Really?
That is correct.
Oh.
Some products will actually add a strain after milk has been fermented, and that strain might survive in an adequate amount to actually show the benefit. But other probiotic yogurts, or yogurts that we use probiotics to do fermentation of the milk, and we usually use some of the old and known strains to ferment the milk. You can do it at home as well. But commercially available yogurts actually will be exposed to heat to stop the fermentation.
Oh, right. Yes.
To preserve the taste and prolong the expiry date. And that heat kills bacteria very effectively. So some of it will survive, but not most of it. So we don't really know how much live bacteria is in the yogurt that we eat, even though it's a good food for us, but it's not a probiotic.
Wow.
So that's the first thing. And then, when you talk about probiotics, taking probiotics, they're good for us. It's very specific. We have to approach probiotics as we approach medications.
Okay.
We do not tell patient, go to the pharmacy and get a medication for you. We tell the patient, take this medication for this reason. This is the name of it. That's the strength. This is how you take it.
Right.
And they go to the pharmacy and purchase it.
Mm-hmm.
We should be doing the same with probiotics. We have to tell patients what specific strain or combination of strains they have to take for this expected effect.
Mm-hmm.
So basically using it as a therapy.
Mm-hmm. And in order to do that, you have to know what you're treating. So you have, I believe, a certain strain or strains that will help with a certain disease state or condition. And so could you talk a little bit about that, how probiotics actually, we have to look at how they impact health outcomes. I think that's what you're getting at. Is that right?
Exactly. The reason I was, giving you this long-winded answer first, you asked about regulations. So regulations in Canada will allow probiotic strain to be sold as a supplement or added to food, as long as there's a proof of safety. And some of the approvals are done based on a species, not actual strain. So the company might file the strain name with the Health Canada, but might not list the strain of probiotics on their label. So it gets a bit confusing. And you and I can probably get some approval for a strain of probiotic and, make a product and sell it. Because really the regulations are not so stringent. They just have to prove the safety.
And is that why we have so many of them on the market now?
Yes, when you look at the Health Canada website, and they have a list of different kinds of species that have been approved. So automatically, if you pick something from that species, which is kind of family of strains, you get approval. So we have lots of products. And what is also interesting is that quite a few of the studies were done with a single strain or a specific fixed combination of 2 or 3 or maybe more strains. However, most of the companies will maybe select one strain that is proven, but to make their product slightly different than competition, they'll add a few more different strains.
Oh.
Whether they work together well, we don't know. Nobody knows unless there is a study done with that new fixed combination.
And because we have so many products on the market now, can the research even keep up with all of these products? Do you think that there is a lack of research, or do we have a good base for the research as of now?
So I would say research is definitely still very strong, and looking at different kinds of combination of strains, different products, etc. But we cannot ever keep up with all those imaginative combination of strains that different companies put out, with the hope and assumption that more the merrier. More strains you mix together, maybe higher number of viable cells, it will be better effect. That's not always the case. Sometimes quite opposite.
Yeah, and this leads to the question that we get. So if you walk into a health food store or a pharmacy and you're met with this incredible amount of different probiotic products, and you see this 5 billion versus 10 billion on the cover of the product, and you wonder, what is the difference? So it's not just even the strain, but it's the actual amount. How does that play into the efficacy of a product?
That is a great question. So some strains are viable and they can provide benefit with a very low dose.
Okay.
Some of the well-known strains in Canada will provide amazing benefits with 500 million per dose per day.
Okay.
Others will have a 450 billion per dose. So it depends what the strain is and what kind of outcome we are hoping to achieve. If you have a strain that has proof that works at 500 million, there's no point of taking more of the same strain. This is another marketing, I would say, approach that, let's have more, so it will sound it's actually better. So it's really not like a medication, higher dose you have, then you have, different effect, because there were even some studies with, again, some of the well-known strains, and when they were trying to determine what dose would work the best, they used 10 to 8, 10 to 9, and 10 to 10 billion of the colony forming units. And they found that the middle dose was the best. They were expecting with a higher dose they'll have an even better effect, but they did not. It was very similar to placebo. Later on, it was determined that capsule was not dissolving appropriately because it was too packed with too many strains. So more does not always mean better.
And when we get a probiotic capsule, and we're buying it for the potency, are there other things mixed into that capsule there? Like you said, that the capsule was so packed. Is it just bacteria, or are there things that need to also be added to that for that bacteria to remain viable?
So some of the bacteria are actually frozen in a specific way to preserve their ability not to populate, but to
proliferate
in our gut for a certain period of time, to keep them viable. Some other bacteria, for example, are in a spore form. They don't have to be frozen. They are viable even exposed to the high temperatures. So it depends on a strain. And depends on a way of preparation. Sometimes there are some fillers in a capsule, but that's just a manufacturing process, does not have any impact on the bacteria itself.
Okay, well, that's good to know. And then what about, we see some probiotics are stored in fridges and then others are just kept on the shelf. Are probiotics that are refrigerated better? Are they worth because they're more expensive as well. What is your take on those?
So this is a very common question, and many patients ask me about it, or they would come to me and tell me that refrigerated products are better because they've been told that. That's not true. That is not true. That also depends on a strain. As I mentioned, some strains are very sensitive to exposure to heat or to oxygen, and they need to be refrigerated to preserve the viability. Other strains are stable at the room temperature for a long period of time, and some you can expose to heat, even bake with them, and they will still stay viable. Not many, but few of them. So it's really refrigerated is just the indication that strain that you're buying is not very stable and needs to be refrigerated.
I did not know that. I was even told that they were better if they were refrigerated generally. That's really, really interesting. I think that's a very common thought. Yeah.
One of the things that, recently, but for years, we had a product for baby colic. I'm not going to mention any names because I'm not promoting anybody. It was a drops form for baby colic, and we had to keep it in a fridge. And then a couple of years ago, they changed. It was the same product, same drops, same dose, but it was stable at the room temperature. The only difference they made a bottle that will not allow oxygen to go back in. That was the only thing. And by doing that, they made that bacteria more stable. So it was not really that bacteria was not stable at a higher temperature, but the oxygen would actually be killing it. So when bottle was not allowing oxygen back in, it was stable at the room temperature.
Wow. I know which one you're talking about. That's interesting. I've seen some of your talks on taking a probiotic for a specific health outcome, but for the general population, it's someone who's, pretty healthy, but they just think they should take a probiotic every day. Is this a good idea? Could this ever cause harm? Is there a certain strain that would be better? And should they actually even take that strain every day for a year, or is it better to kind of change things up? I realize that's quite a few questions.
There are a few questions, which great questions, and they are very, very common questions. So with taking probiotics prophylactically for general health, that is very, very common question. Most of us that are looking after ourselves with a moderate amount of stress, with a good balanced diet, with a good enough fiber in a diet, we do not need to take probiotic.
Okay.
In the guide, we also list some probiotics that are maybe used to minimize the risk of getting common infectious disease. So maybe if members of my family are fighting a colds, or I'm working in a clinic that everybody is coming in with the colds, I might, for that period of time, take a probiotic product that has good evidence in preventing common infectious disease. Or if I'm traveling, I might take a probiotic to minimize the risk of traveler's diarrhea. Or, if I need to take antibiotics, then I'll definitely take a probiotic from the guide, one of them, that will minimize the risk of getting antibiotic-associated diarrhea as a side effect of it. So even for general population, there might be times that you might need a probiotic to minimize the risk. If you do have a problem, then you select one to look after your symptoms. But again, generally, we do not need to take probiotic. And if you are taking a probiotic, it's usually short term. Usually in up to 3 months, if symptoms resolve, like IBS, or you stop traveling after 3 months or something, which none of us will travel, but that's okay. Then when there is no need, then you stop it. If symptoms return, you continue it. Some chronic conditions might require long-term use of probiotics, like the inflammatory bowel disease, ulcerative colitis. There's good evidence in taking probiotics regularly to minimize the risk of a flare-up. But generally, taking probiotic, it's not needed. And you mentioned there have been some studies looking at patients that were maybe taking probiotic, a single strain, for too long period of time. They would actually affect the diversity of their gut microbes temporarily, because that you are adding very potent, even though it's a good bacteria, for too long. So it's really taking over. It's taking the food from your own bacteria in the gut and affecting the diversity. So too much of a good thing is not a good thing.
That's really important that people hear that, because I know that we all just want to do something good for our health. And sometimes if we take something, it helps us, feel like we are trying to protect our body more, and maybe, helping to diversify our microbiome by doing this, but maybe it's not always the best thing to do in certain scenarios. Is there a better time to take a probiotic? So we know with medications, sometimes certain medications are better with food, certain medications are better to take in the morning. What about probiotics?
So probiotics, timing doesn't really matter. With or without food is most of the time fine. Unless you're taking it with alcohol, maybe it might affect it, or something that is extremely acidic. We don't really know, but most of the probiotics that are used as the supplements or added to foods are fine to be taken anytime during the day, or with or without food. One of the things that we still use as a recommendation if you are taking antibiotics is that you do not take probiotic at the same time.
Right.
At least 2 hours apart. However, that is not based in a hard science. That's kind of an old empirical recommendation, because we assume that would be a good idea. It might change in the future, because right now we have some pilot studies using a specific probiotic combination along the antibiotic in the same capsule, and they are finding better outcomes compared to using antibiotic on its own.
Oh, that's really interesting.
Yeah, Dr. Gregor Reed and his team has done some research even before, and they did find that taking probiotics along with antibiotics does increase the effect of antibiotics at the mucosal site where it should be working. So it seemed to be that taking probiotics with antibiotic not only prevents the adverse effects of antibiotic, but enhances the effect and benefit of antibiotic.
Wow, that is something that I have not heard. So they're actually testing a capsule with the antibiotic and probiotic together.
That's correct.
That's fascinating. Well, that's really important for people to know as well.
Absolutely. Wow. In the times of of the antibiotic stewardship, and we are trying to minimize the overuse of antibiotics, if we can curb that increase somehow, and make sure we do not develop more and more of the antibiotic resistant bacteria, that would be a good outcome.
And you did mention this a little bit, but I wanted to ask you again, can probiotics ever cause harm, or have you seen certain products that could potentially cause harm for certain people?
So, but we know regarding safety of probiotics, because this is, again, a live bacteria. In patients that are severely immunocompromised, or people that are in ICU or on a central venous catheter, we exercise caution, and those patients have to be supervised if they are given probiotics, because there are few cases of probiotic sepsis getting into the bloodstream.
Oh, okay.
On the other hand, there's also lots of research and lots of push to use probiotics to minimize specific probiotics to minimize the risk of ventilator-associated pneumonia. So those are patients on ventilators. They are really severely ill patients. And when they are given specific strain of probiotic, they actually do not develop the pneumonia associated with the ventilator use.
Oh, okay.
So it's something that we would usually leave for hospital staff to decide whether to use it or not. Most of the ambulatory patients that come to the pharmacy or they can walk into the primary care clinic can use probiotic, carefully selected. Just as a one illustration, I work in the primary care clinic, and I've been asking my patients up to pandemic time when I was seeing them in person, every time I reconcile the medication list, if they are using anything over-the-counter, supplements, vitamins, they might tell me what they take. But then they was, oh yes, and I take probiotic, but they don't think this is a supplement. They think this is something that everybody should be taking.
Right.
95% of my patients were taking it. Those are patients that cannot afford their insulin for their sugar, but they would base their money on probiotic. So lots of education took place, and most of the patients did not even know why they're taking it or what kind, what is the desired outcome with that. So this is problem. This is problem for patients that are really not utilizing their resources properly. However, I had few patients that have experienced more severe side effects of probiotics. One lady that was well-controlled diabetic, elderly lady, was great, and then suddenly her A1C went up. We were a bit concerned. Nothing changed except that she stopped walking. She did not want to walk outside. She did not leave her house because she developed the fecal incontinence. She was embarrassed. She didn't want to move. So that was the only difference. And she told us, we were thinking about recommending a probiotic, even though it was experimental and off-label. But she said, oh, I'm already taking it. And I doubled the dose and it made it worse. So she was taking one of those no-name big store, probiotics with a million different kinds of strains and lots of different CFUs in it. So we advised her to stop that probiotic for 2 weeks, and then we were planning to do some more investigation with gastroenterologist. A week later, she called us and she told us she has her life back. The fecal incontinence actually stopped completely.
Wow.
She was very mad with her kids because her kids purchased the probiotic to her and told her to double the dose when she developed the fecal incontinence. This is something that it's not common. We were planning to report this to Canada Vigilance. However, she did not have a label. She said she tossed everything in the garbage. So she did not remember exactly what brand she was taking. So for cases like that, I do encourage pharmacists to document and report so we then learn more about incidences like that.
And this is why it's so important to have conversations with our patients and also to know the evidence, right? Because that's a prime example of just someone who was trying to do the right thing and thought that they would help their gut when really it actually exacerbated the problem for them. And to them, it was not obvious. But when you sit down and have that conversation to someone like you, we don't all have access to someone like you. But, when we have that conversation, then we can actually trace it back. And it, often she was probably thinking she had some very serious illness when really just taking that probiotic away, like you said, changed her life.
That's correct. So again, we are doing follow-ups and everything seemed to be fine. And she's back to her regular amount of physical activity. Her A1C is improving without any other interventions. So it's a kind of an interesting day in practice, definitely.
Yeah. And that's just one case. So we're not saying that would be, happen to a lot of different people. But it is significant. And it kind of leads me to my next question. So in her case, if she was taking other medications and having that kind of intestinal flow for that long, it could have reduce the absorption of some of her medications. But what I wanted to ask you is if probiotics generally do they interfere with medications? We know that some drugs can interact with each other. Some foods can cause issues with medication absorption. What about probiotics?
So probiotics per se should not interfere with the absorption of medications. Good and healthy and diverse microbiota in a gut will actually enhance absorption of certain medications. Some of the medications actually depend on a well-functioning gut microbiota, and we are learning more and more about it. So it's a very interesting, just making sure that you have you eliminate any things in your life that will actually affect your good, used to call it flora, but this is obsolete term, gut microbiota. Sometimes even, as you mentioned, at times when you're not eating properly, maybe taking a higher amount of fiber in your food, short-term probiotic, just to get that everything back to normal would be a good idea. Okay. And I've often heard about people taking probiotics to, say, prevent a yeast infection, also to prevent a urinary tract infection. Is there any evidence that probiotics can be helpful in these cases? Absolutely. Yeast infection, bacterial vaginal infection. We have lots of evidence, lots of studies to support a specific probiotic strain combinations. In Canada, we have oral combination and we have vaginal application of probiotics for both issues. In US, it's oral only, then you don't have any vaginal products that have good evidence.
Okay.
What is also interesting that that same combination that has the best evidence for vaginal yeast infection and bacterial infection, they have a good evidence for minimizing the risk of bladder infection or urinary tract infections. Some studies were actually fairly small. They were designed to show non-inferiority to sulfa drugs, which is great. However, the difference did not reach statistical significance, but they had no antibiotic resistance developed in the population that was using probiotic. However, in population that was using antibiotic, the standard approach for the UTI, they have developed very increasingly and rapidly antibiotic resistance. So this is why we are looking at potentially adding this particular indication to the guide. Every year we review what is new. We are waiting for a little bit more data to kind of get this critical weight and to get the consensus of all expert reviewers to agree that we can list this particular product as a prevention of the urinary tract infection.
And we're going to give the links for the guide in the description of the video for anyone who's wondering what these strains are. It's too complicated to just for Dragana to just say which strain for which thing, but we will give you a link to the guide in the description of this video. So I just wanted to make that clear. Dragana, what about for cholesterol? Is there any evidence that probiotics or the use of probiotics can have any effect on our cholesterol?
So there is a probiotic strain that has a fairly good evidence in lowering LDL, also lowering fibrinogen and a few other inflammatory parameters in patients with dyslipidemia. Unfortunately, this particular strain is no longer available in Canada just because there's nobody marketing it. It's still available in US. And what is kind of almost sad, most of the research with that particular strain happened at McGill University in Montreal. So it's kind of Canadian, research project and lots of studies done there. Really good evidence. It was available I can say the name because it's no longer available, CardioViva, but it's been discontinued. So that particular strain is available in US. Not in Canada yet, so we are looking for that.
And in that case, how did the use of a probiotic have an effect on cholesterol? Was it on the absorption, or what was the mechanism there?
So it was few different postulated mechanisms of action, effect on the liver, effect on absorption, effect on conjugation of some fat inside the lumen of the gut. So it's really multiple mechanisms of action with the probiotics.
Very interesting. And are there, when we look at these probiotics, like I said, in the store or in the pharmacy, are there any red flags that you would watch out for, say, even on the product labeling, or anything that you would just look at and say, well, this is not something that's going to be worth my money, or even expiry dates or anything like that?
First, a red flag would be if there is no strain, do not bother with it. What means when I say strain, when we define or name the bacteria as a probiotic, it has genus, species, and strain. Lactobacillus acidophilus, lactobacillus is a genus, acidophilus is species, but it has to have a strain, has to have something at the end. Like, for example, LA5 is one of the strains of Lactobacillus acidophilus. So it has to have this kind of a funny, long name with the ending with a series of letters and numbers that specifies the strain. I do not like to talk so bad about the market status of probiotics, but just as a kind of a warning, if the company does not list a strain on a label, that means they can switch the strain on you. If it's not available for them to purchase the LA5, for example, they'll put something else that has still Lactobacillus acidophilus. So this is why looking for strain would be first a must.
Okay.
Then think about it, whether this strain has any evidence, check the guide, see if it's listed in the guide and what this could be used for. That's the second part. For us, working in a pharmacy or walking to pharmacy and, buying, for example, aspirin or store brand aspirin, we know there's not much difference, Tylenol versus store brand Tylenol. But when it comes to probiotics, there are no store brand probiotics or generic probiotics. Strain is a strain regardless who makes it. So look for the strain that has been supported by evidence. That's a key thing to remember.
Okay. And so under what situations would you recommend a probiotic to someone? I mean, I know there are a lot of different disease states, but in your day-to-day, what would be some conditions or some issues that you come across where you say this person needs a probiotic? This is good that you're asking this, some of the positive things about probiotics. And, I do see the effects of probiotics if they are selected carefully. They're changing lives for patients. So one of the very common conditions is irritable bowel syndrome. And patients are frustrated because it's quite often something that is being they try numerous different things and they don't get the results, or they get the results short term, and then everything goes back to previous, and symptoms are unpredictable and life altering. So they don't even want to talk about it. And they tell me, yes, I've tried all different kinds of probiotics and made the condition worse. So if you select a probiotic, one of few that have good evidence listed in the guide, and develop a plan with patient, let's try this one for 4 to 6 weeks or maybe 12 weeks, and then we'll switch to that next one if there's no results. Quite often, even with the first intervention, we do achieve symptom resolution in most patients. And those are the patients that will actually bring us flowers or send some cookies or chocolate to the clinic, because they said we have our life back. So as this is one of it is very common. We see those patients commonly. We see in a list of their conditions, IBS. Nobody wants to talk about it anymore. We think it's already been addressed, but it's not quite often. So IBS is one. Babies, newborns, colic is very common. We can use probiotics short-term with great results. Eczema is another one. We have more and more evidence for use of probiotics in eczema, in childhood eczema and atopic dermatitis. Oh, wow.
Common infectious diseases in kids that attend daycare, preventing them so they, parents don't have to take the day off every second day in the week. there is a role for probiotics there as well. In adult population, if every time we prescribe antibiotics for any reason, we prescribe specific probiotic. Patients with inflammatory bowel disease usually are already on probiotics prescribed by gastroenterologist, especially ulcerative colitis and pouchitis. It's the best evidence for those two. And then we are expanding the use of probiotics beyond gut. Last couple of years, we have a product in Canada and US that will actually could be used to prevent or treat mastitis in breastfeeding mothers.
Oh, really? Wow.
So that is I would say, very encouraging. This product was available in Europe for a long time. We were aware of the evidence, but we did not have the product. Here now we have. And this is really supporting good infant health if the mother is able to continue breastfeeding and resolve mastitis fairly quickly. So as I said, these are quite a few different interesting things that go beyond gut. Migraine prevention is one with probiotics, weight management as well, prevention of gestational diabetes. There's a new product we just listed for lowering postprandial blood sugar in type 2 diabetes. So we are seeing more and more indications for probiotics beyond gut.
Wow. And is this, so you say we're seeing all of these indications and we're seeing positive outcomes. Is this because our gut is generally unhealthy, or what has happened to the human body and to the microbiome is it just that our diet is maybe not adequate? Or what do you think is kind of the driving factor behind why we're seeing such incredible outcomes when we add a probiotic?
So I'm sure that it's a few things. First of all, yes, we are looking more and researching more probiotic impact and influence. That's the number one. But the fact remains, and it's probably another half an hour talk about why we are here. Right. Dr. Martin Blaser wrote a book about it, about probably overuse and misuse of antibiotics in the previous generation. And that has impact and influence of metabolic health of the population. Right. And then what's interesting also, mother's gut microbiota will actually impact and influence baby in utero. Okay. So not by crossing, bacteria does not really cross into the placenta to the baby, but there are messaging that is happening from the maternal gut to utero, in fetus in utero, that might have this kind of a transgenerational impact. Babies born with C-section versus babies born with the vaginal birth have different outcomes. Exposure to early bacteria in your environment, caregivers, the hygiene theory when we were sterilizing everything baby touches was not a good idea. Dr. Brett Finley wrote a book, Let Them Eat Dirt.
Yes, I saw that. Yes.
So it's excellent book talking about, expose kids, let kids play outside, let them be in contact with animals, with other kids, to exchange all those bacteria and to build a healthy, diverse composition of the bacteria in the gut that will then set them for life. Because what we form in our first years of life, we actually carry for the rest of the life. It's our unique gut microbiota fingerprint, or as Dr. Alan Everka said, it's a poop print we carry throughout the life, and we hope to maintain throughout the life, even though it changes based on what we eat, what we do, what medications we take. Stress can affect it, lack of sleep can affect it. As I say, when I talk with my patients about diet and about fiber, they roll their eyes. They, increase fiber. Oh yeah. But when you explain to them, it's not only to promote bowel movements, it is actually to feed this a huge family of bacteria you have in your gut and keep them healthy. If you turn them against you, you're going to have into big problems. So feed them well, you'll be happy, they'll be happy. So, diverse, balanced diet is huge. And we have recently published studies about looking at Mediterranean diet and impact on overall health. It is via the gut microbiome being happy with that diet. So it's all goes back to gut.
And so when we look at these probiotics, like I have just some that I have here at home. I won't show it too much because we're not promoting any particular kind of product here. But when you look at the dosage, so often it will say take 1 to 3 capsules once a day, or take 6 capsules. Like it really, really varies. Do you find that dosing is based on evidence, or can we just kind of figure it out for ourselves? Like, is there a better way to do this, or do we really need to follow exactly what's on here? Because sometimes taking 6 capsules a day seems a bit excessive. What are your thoughts on this?
So I would suggest to stick, if you're taking probiotic, stick with what's listed in the guide. Okay. And in the guide, you have the dose. And the dose is based not on what's on the label, but what was used in a study to achieve the outcome. If you do have some probiotic at home, you like to try it and you like to not waste it, go with a lower dose. See how it works. Too much of a good thing, again, is not always a good thing. Sometimes they say take 6 capsules because they might not have enough per capsule of viable bacteria. So it's all different kinds of reasons why the dose might vary. I'm just trying to think if there's something that we can take less for one reason, more for the other. In probiotics, not so much. Quite often, it's the same dose used for different kinds of issues. And sometimes it could be just 5 drops per day or just 1 capsule a day, and with great outcomes. And if you increase the dose, you don't get actually much more.
And that's good to know. And in pharmacy, we tend to take that approach as well. We want the lowest, most effective, safest dose, and we start low and we go slow, right? So it's kind of sounds like it's a similar approach with probiotics.
Absolutely. And I always like to kind of tell my patients to save money.
Yes,
maybe go and get some asparagus and broccoli instead, or feed your good gut bacteria.
Yeah.
So it's interesting, but again, it is normal that patients like to be proactive and like to be take control of their life and their health and try to do something good for their health. But taking probiotic can really make a big difference if it is selected and used appropriately, or it could be just a monumental waste of money and time.
This has all been really, really valuable, Dragana. I have some viewer questions that have come in from the audience and from different social media sites. Would you be willing to answer a few more questions? That's great.
Absolutely.
One that was, what about people with a lactose intolerance? Can they generally tolerate probiotics, or are there some that I know lactobacillus is something that people often think, oh no, lactobacillus, lactose intolerance. What is your guidance on this?
So people that have lactose intolerance, they should avoid products that have a dairy or based on dairy. However, taking any kind of lactobacillus strain, it doesn't mean it has lactose. It means that the lactose in the gut will be broken up much quicker.
Okay.
So, basically, the any lactobacillus will love lactose to eat, to ferment and to break down. So lactobacillus might be actually helpful for patients that have lactose intolerance. There have been some studies. They have done some good research with the strains that are not yet available commercially. So hopefully we'll see soon some products that will be actually probiotics used for lactose intolerance. But if they are trying to use probiotic for some other reason, and they are worrying about having lactobacillus or lacto in a name, there is no contraindication in using it.
Okay, that's great. That's good to know. What about taking probiotics for traveler's diarrhea? I know you mentioned this a little bit earlier. We do have an oral vaccine to help prevent traveler's diarrhea. But in practice, I've actually had patients come to me and say, actually, I took probiotics for 2 weeks prior to my trip and during, and I had no issue. Is this just anecdotal, or is there actual evidence for this?
I believe the number needed to treat for traveler's diarrhea for specific probiotic is very low. It's 7 or 9, I don't recall exactly. So it's really good, very efficacious approach to prevent traveler's diarrhea. 2 weeks prior to travel might not be necessary. We usually suggest at least a couple of days or a week prior to travel, throughout the travel, and a few days after.
Okay.
And it is definitely comparable or even more effective than some of the standard approach that we have.
Oh, wow. Okay. That's great to know. So there is definitely some evidence for that. That's great. I have a specific question here. So this would be like a little bit of a case study. So just bear with me. So for someone who has had colon surgery and afterwards they were put on a really high dose of antibiotics, what impact would probiotics or yogurt have on restoring the gut flora in the colon? So you've already said that we really don't know if yogurt is that helpful, and maybe it's not helpful at all. But what about probiotics, or what would you suggest for this patient? Of course, you don't have all of their history. You don't know everything else they might be taking or have gone through. But just generally speaking, could probiotics be helpful in this case?
So few things. Some yogurts in Canada and US actually have probiotic strains added to the product.
Yes.
That is already done. So they have very strong viable. So not all yogurts are not.
Okay. Okay, good. Yes.
For this specific patient, you mentioned colon surgery, or depends on what kind of surgery.
Mm-hmm.
For example, we have used very strong, well-researched probiotic combination strains for the pouchitis. That is fairly invasive surgery, gastrointestinal surgery, and they would be given antibiotics, and following that, they'll be given this particular probiotic to minimize this flare-up and improve healing after with the level 1 evidence. It is actually recommended as a first line. Mm-hmm. So it depends on what kind of surgery, depends on what kind of antibiotics. If with antibiotics, it's always a good idea to take a probiotic to minimize the risk of adverse effects. But for this particular patient, I would suggest that maybe take the guide back to the gastroenterologist or surgeon and ask, first of all, if it's safe to take and which kind would they recommend.
Mm-hmm. Okay. And then how should a person take probiotics with food or on an empty stomach? I think you've said that it does not really matter too much.
It doesn't really.
Okay. With a glass of water, does it really matter?
Probably a glass of water would be the best. Yes.
Okay. And are probiotics more for treatment of a certain condition, or can they also be used as prophylaxis? I know you touched on that a little bit. Any concerns with people who want to take it for prophylaxis?
I would say no, but again, I would also challenge those patients. They would like to prevent what? What is the outcome like to achieve? When, for example, these days we are taking some supplements or vitamins. Some of them, there is very good evidence for specific population that might be a good idea to take, but taking just a multivitamin because we think it would be maybe a good idea, it's not always good. There's recent studies showing that increases mortality and morbidity in patients taking multivitamin daily for no reason. So it's really individualizing approach and then selecting a supplement that you really might benefit from. So that would be my approach. We really do not know enough about potential risks or side effects of long-term use. I'm sure we'll learn a lot in the near future because we tend to overdo many things.
Yeah.
And then we suffer the consequences. But if it's not broken, don't fix it. So that is my suggestion. And I'm a pharmacist. I tell my patients, I'm a pharmacist that do not like drugs. If you can do something without too many drugs, great. But we sometimes do need drugs or probiotics to fix something.
Yeah, and I appreciate you saying that, because I also, as a pharmacist, I don't really want people to take medications unless they need them. Like, they have their place and there is a time for them. But whenever you can do something that is, say, a change in diet or a change in lifestyle or something that is evidence-based, right, where you could eliminate a drug that's maybe not necessary or something like that. This is actually one of the big passions of pharmacists, and it kind of gets missed because as a pharmacist, you get this this general label that, well, you're, maybe big pharma or whatever. It's really a misconception, because we actually want you to be healthy And, if you need the medication, and some people's lives have been dramatically changed by the benefits of certain medications, right? But it's not always the best answer, right?
Absolutely. And I'm proud to be in Canada, where, choosing wisely is a great intervention, that we are really selecting appropriate interventions for patients and not overusing, things that are not necessary. Also, as a pharmacist, we are part of this deep prescribing network, which means we are taking people off the unnecessary medications because that seemed to be, maybe it was appropriate 10 years ago, but there's no need any longer. So we would actually attempt to discontinue or stop certain medications. So that kind of same approach should be done with the probiotics. If there's a need for it, let's then talk about it. Let's see what is the evidence, select appropriate one, plan how long you want to take it, how you measure the outcome, and then decide what's next. Just taking it because it sounds great, because it's, microbiota, microbiome, probiotics is a buzzword these days. I would say resist that, invest your money into something better.
And we didn't discuss this question, so I might be putting you on the spot, but with all of the evidence coming in about the benefits of probiotics for certain conditions, have you seen any third-party insurance plans start to cover probiotics in any cases if they're prescribed? What is the scenario like in Canada for that right now?
For some of the private insurances, there is a process. Usually it is started with the gastroenterologist.
Yep.
There is usually a standard letter they can write about a specific probiotic strains or combination of strains that they have to provide the evidence and support and, say this is going to be offering you saving in long term because we'll minimize the risk of relapse or flare up of different kinds of, severe condition, specifically inflammatory bowel disease. And in some cases, the patients would get it covered.
Okay, well, that's good to know. And you also touched earlier on migraine and probiotics. Now, we've actually had someone talk about migraine on the show here, a pharmacist. And what is the evidence for the use of probiotics with migraine? Because people have migraines, once a month, twice a month. Some people suffer multiple times a month from chronic migraine. So if you're taking a probiotic for, I would guess it's prophylaxis, is that a daily thing, or what have you seen? What is the research looking like on this topic so far?
So this particular combination of strains is available in US, not in Canada.
Okay.
It is used prophylactically and it's used daily. And again, it is in a population of, it was mostly women, and it is mostly women of childbearing age. So again, we don't really know what is the mechanism of action, whether it's something that has to do with the hormonal fluctuations or regulating the hormones via gut metabolism. So we don't know mechanism of action. And it's really, I believe it's a level 2 evidence for migraine prevention, but it is encouraging to see research going that way as well.
And just touching on that as well, is there any evidence as far as menopause or even PMS, treating PMS or anything like that? Do we have any positive evidence for that?
For probiotics, not yet.
Not yet. Okay.
I would love to see that. Absolutely. Aside from being a clinical pharmacist working in primary care and working with probiotics is my passion, I'm also a credentialed menopause practitioner. I work with the North American Menopause Society. 3 years ago now, when we had our last big meeting, I was moderating a big session on women and their microbes. And we were looking at use of probiotics for vaginal health, basically. So not only for the vaginal yeast infection, bacterial vaginosis, but also improving the vaginal lining or lowering the Nugent scores, and preventing actually risk of any complications with the use of probiotics. So we had Dr. Jack Gilbert, which is world-renowned scientist, talk, and another physician speak about her research in that field. So it's really, hopefully we'll see more and more data coming from that research and learn more about it. But for vasomotor symptoms, unfortunately, nothing yet.
Nothing yet. Okay.
I'd love to see that. Yeah.
No, but thanks for sharing that. And just lastly, what is the general knowledge base that you see when you are working with different physicians or different healthcare professionals? For me, I feel like I just have learned so much just from talking to you for an hour, even though I do read, all the pharmacy magazines, try to stay on top of all the literature. What do you think the gaps are right now as far as knowledge about probiotics with physicians and pharmacists and other healthcare professionals?
I think we still have to do lots of education. Lots of communication. I think the healthcare professionals are overwhelmed with the amount of data coming, or big headlines and new research that when they don't have a basic understanding yet. So this is something that we are trying to address as well. So aside from producing the probiotic guide, and you showed this in the print, and I have a Canadian and US guide here, which is great.
Perfect.
We also have this information that is presented in a guide online, which is easier to search for indication, because you can do the search button and put the indication you need, and then filter only those products that have good evidence for that particular indication. Check the references, print off the handout to your patient if you like. Also, the data is available as a mobile app, very easy to search. But we also, aside from the guide, expanding the education to offer different kinds of webinars for healthcare professionals, inpatients, education guides, which is just one pager for a specific topic, and we talk about it and we list the products that could be used for it. We have animations, and this is all done with the support of a group of great, I would say, team. It's Alliance for Education on Probiotics, because again, we recognize the gaps, some kind of basic fundamental gaps in education at medical schools, pharmacy schools. I told you my experience. It was telling people to eat yogurt with their antibiotics, because we never learned about this at school. So we are trying to fill that gap and provide as much information, education as possible.
And you've really done an incredible amount of work here. And so, like I said, all the links will be in the description, but it is just a wealth of information. And it's not just information, it's evidence-based research. This is high quality information for people to use as a reference, right? And it is an area that has expanded so quickly. Like you said, healthcare professionals have trouble keeping up with all this, and we're constantly looking for good resources that we can, when we recommended a product to our patients, we know that there's evidence behind it, and we know that we're recommending the right product for our patients, so they'll get benefit. Because one of the other things that is so difficult sometimes, even as a pharmacist, is when we see our patients spending money and they're not necessarily going to get the benefit from it, right? So the work you've done here, the clinical guide to probiotics, check it out. If you're a healthcare professional, you're looking for some kind of a resource, or even if you're just looking for something for yourself, it's free, and it's incredibly rich information for everyone.
Thank you for the kind words, but I also like to say this is I like to support pharmacists. I like to make them more confident and knowledgeable when they are faced with the questions about probiotics, because I like the patients to really appreciate, understand how pharmacists are real experts in this, and to try to get them to see pharmacists instead of a health food store sales clerk for the recommendation on probiotics. So that should be your source of information for sure.
That's excellent. Well, thank you so much for your time, Dragana. We've managed to get through all of the questions today, and I'm sure that the audience will be very, very appreciative of your time and the knowledge that you've shared with us. So thank you for joining us today.
Thank you for having me, and I really appreciate you hosting this and all the education that you are doing on so many different topics. Thank you.
Well, thank you. It's an honor to be able to do this and to do this with you today. So thank you so much.